Patty, returning to normal after having COVID, it can be complicated. Many people, myself included, are experiencing those lingering symptoms.
Yeah, a lot of questions. We spent a lot of time talking about it in the commercial breaks, and something you can do is get a physical to double check how you're doing. Dr. Celeste Reese-Willis is here. Another Monday edition of CBS 42 House Calls. Another Monday you make us all feel like we don't look quite as good as we should at 6:45 in the morning. Dr. Celeste, good to see you. Thanks for being here.
Good morning. How are you guys?
We're doing well. So talk to us
Good.
about a post-COVID physical. That's smart advice, I think.
Well, generally, we recommend that you follow up with your regular physician at least 4 weeks after your diagnosis. The purpose of this is because there are some people that actually have COVID that experience no symptoms at all, that start to experience symptoms anywhere from 4 weeks on afterwards. And that's experience symptoms. There are people that are completely asymptomatic, and this happens in about 19% of individuals that are asymptomatic, but go on later to experience breathlessness, tiredness, fatigue, loss of taste and smell, diarrhea, headache, pain, joint pain, muscle pain, dizziness, rash. I could go on and on. And so having a physical with your regular physician is definitely recommended to make sure that all of your organ systems are intact.
So how you're saying, in other words, people have COVID, they think, oh, I got through that, it's no big deal. For me, I didn't have many symptoms, and they deal with this for months and months and months. Do you think people sometimes don't even attribute it to COVID? They just think they're having these symptoms randomly?
Yes, absolutely. And that's part of the reason for the physical, is because you want to attest to, and there are a lot of common what we call post-COVID conditions, and those are conditions that people get after about 4 weeks after being infected with the virus, or symptoms that persist rather 4 weeks after they're infected with the virus. The most common of those is pain, breathing difficulties, hyperlipidemia, which is high cholesterol, high blood pressure, as well as most people complain of malaise and fatigue. And so we want to check your blood work, make sure that all of your organ systems are okay. We want to listen to your lungs, make sure your lungs are intact. We want to make sure that just overall you're not having any persistent effects from the COVID-19 infection. And if you do, we want to make sure that we address those.
Right, it's the respiratory virus that doesn't realize it's respiratory, right, Dr. Celeste?
Basically.
Yeah.
Do you think this is endemic at this point? I mean, are we ever going to be done with this, or do you think in a year are we still going to be talking about, is it COVID season, like it's flu season?
Jack, honestly, I don't know. I didn't imagine a year ago that we would still be having these conversations about COVID, to be honest with you. So I can be, my honest answer is I don't know. I pray that we're not. I hope that we're not. I hope that we turn a corner with this, and that we're able to gain herd immunity and decrease the spread of this virus that is ravishing our country. I don't know. That's the honest answer.
Remember when we thought 2021 was going to be so much better than 2020?
Yeah, the challenges follow us. Well, Dr. Celeste, thank you for always being here and sharing your wisdom and expertise. It is valuable to us and to our viewers, and we are grateful. And don't forget, if you have a question for Dr. Celeste, you can send it right to her.
Yeah, just email us, housecalls@cbs42.com, or send us a message on Facebook. We'll be right back here on the CBS 42 Morning News.